Azinui, good evening. How are you today, girl? How is UK this evening? Happy to see you on live. We are doing a revision class in preparation for the exams next week. So I guess you don't mind staying by. You're not working today. Please, as you're entering the class, you should indicate by your names. Good evening, Tikum Odrin. You happen to enter the class now. You have been struggling to get in that there was network problem. I guess now everybody got in. It seems like when there was network problems, I clicked on something that the live went private. And even I myself could not get in. All right. I'm so happy that everybody is coming in. Chevelle, you were not in class yesterday. Neither were you today. All right, Kelly, I see the hand. Chevelle, where were you? Welcome to class. Hey, good evening, Anyam. Ashitame. Your name is difficult. Good evening, Mom. I'm good. How are you too? UK is good. Just close from work, heading home, and I received a notification of your live. Thank you so very much. I'm so grateful for your support there. Hey, Hans. Hey, good evening. Jacob, where are you from? I'm from Cameroon. Hello, my name is Diana. I'm from Argentina. Hey, Argentina's in the house. Greetings. Hello. All right. So now the live video has been held on because I happen to have put it on private without realizing. So I give my apologies. We are already 91 in the group. Thank you so very much. I appreciate. Varane, I see the message. Hello. All right. From India. All right. I don't speak India. How do they greet somebody in the evening? In Cameroon, we said good evening. Oh, bonsoir. Thank you very much. I thought my headband is crazy, but I have no choice. I haven't made my hair, but my students are my priority, so I don't look at the hairband. Thank you so very much for enjoying it. Yes, this is Cameroonian. We speak both English and French. How are you? I'm fine, thank you. Thank you so very much. I appreciate your kind words. From Philippines. Wow, there are people from Philippines. We are in Cameroon. Patrick from Philippines, good evening. Please, as you're coming in, just take 1 second to click the like button, as well as you click on the subscription. It will go a long way to help me. Thank you so very much. Savion Ward, I appreciate. I'm from America. Okay. Christabel. Crystal. Thank you so very much. We are in Cameroon here. So I guess the time difference here is already about 9 o'clock. I should arrest myself. I guess that's going to be a very good option. All right, please, Blandings, if you guys are in class, indicate. Don't be distracted. I'm still going to keep my eyes on you guys. Hello, I'm from Iran. Wow. Iranians? I worked in the Iranian hospital when I was still in Dubai. Very hospitable people. From Ethiopia. Hosanna. Good evening from Ethiopia. I send greetings. Indonesia. Gang Isaac official. I send greetings. Black woman. Oh yes, we are black magic. Black don't crack. Thank you so very much. time, you're welcome. I'm Nurse Aisha. I'm based in Cameroon. I'm a practical nurse. And today it was a period of time for us to have a revision class. Cynthia, you're in class. Please tell your colleagues to indicate. I just need to start the class, please. All right. Diane is in class. Please don't be distracted. Others will come in, but don't be distracted. Just, I will keep my eyes on you guys as long as you're in class. I don't understand. What are you saying? Nurse Aisha, how are you today? I'm so healthy. Thank you. Oh, Cynthia from the US. Cynthia from Cameroon, come back here. You want to go to the US just through the phone? That's Cynthia from the US. Victory is in class. All right. So the Cynthia is in class. Blandine, Diane is in class. Uh, Victory is present. So we are all equally having a lot of people that are joining in. Don't be distracted. Hello from Chicago. Andre. Hello from Cameroon. How is Chicago today? Deborah is present. Okay, we are going to go to question number 12. I guess we finished question number 11, which indicated which of the following is a symptom of anorexia nervosa. And with our understanding, anorexia nervosa is a situation whereby an individual has extreme fear of eating. Please allow Cynthia to be from... All right. Cynthia, my daughter is watching for you. She said I should allow you come from the US. All right, all right. Cynthia, you can come from the US. Nobody's going to A great day, Andre. I'm really appreciative that you're on my life today. I would like to set an appointment for my blood pressure. Okay, if you are in Cameroon, that will be okay. But if you're not in Cameroon, I guess you are going to check it and then I can read it for you. From Brazil, we have people from Brazil in class. All right, Cynthia, somebody should answer the question. Question number 11. They said A, too much appetite. Or too much appetite, that is symptoms for anorexia nervosa. B, intense fear of gaining weight. C, distorted body image. And D, all of the above. Who is in class? Chica, what is the answer? Always. Where do you live? I live in Cameroon. Here we speak the language of love and the language for the British people. We speak both English and French. I love your hair. Thank you. Even though the hair is so short. Thanks so very much. I wanted to make my hair but feel so tired. I couldn't go to the salon. Hamilton from Brazil. Greetings. I guess it's evening in Brazil now. I'm not sure if we're having the same timeline, but I sent my greetings. Madam, please repeat the question. All right, Victory. Question number 11 says, which of the following is a symptom of anorexia nervosa? And A says too much appetite. B says intense fear of gaining weight. C says distorted body image. And D says all of the above. What is the answer? You are so beautiful. Thank you so very much. D, no. Are you going to say that anorexia nervosa we have too much appetite? The answer is not D. Diane, your answer is wrong. Thank you so very much, Gabriel. I appreciate the kind words. B, intense fear of gaining weight. Correct. Victory, your answer is correct. Cheval. Yes, he says distorted body image. That is correct. But since we already have one answer that is wrong, we cannot take C. The answer, the most appropriate answer will be. Thank you, Tikum Audrey. Audrey, greet your mother for me. Since this is the most perfect, we are looking for the most perfect answer. The answer will be B. Intense fear of gaining weight. You see, When you guys take over the class, the others will stop, leave the comment section for you guys. If you stop, the other people will take the comment section, and that's where the problem comes. No, Diane, it's not D. The answer is B. Extreme or intense fear of gaining weight. It's okay, Diane. It's okay. All right, since it's all understood now, let's go to the next question. Question number 12. Which of the following is a symptom of bulimia nervosa? Yes, Cynthia from the US. Your answer is correct. My daughter said I should allow you be from the US. Azinui that joined us from the UK is my daughter in school when I was still in the nursing school. So she is in class. You guys can send her greetings. She is your senior. So you learn to respect the seniors that are in the house. Are we there? Question number 12. Which of the following is a symptoms of bulimia? Please list some symptoms of bulimia so that we do not have to stay on that question. And thank you, sweetheart. I should. You know, the young ones have to respect the older ones so that they too can be given respect when they are older. Please, my daughter has a YouTube channel. Take 1 minute of your time, click on her name, and then you go to her channel and subscribe. Be kind, please. All right, my Coco is in the house. Ivy, good evening, sweetheart. Azini, Ivynet is in class. Ivynet is on live. Okay, Azini, Sylvia is on live. She's up by Azini. You both got a YouTube channel, please. Just check on my daughter and check on my best friend. Go to their YouTube channels and subscribe. Thank you so very much. Okay, you're seeing her. Thank you so. All right. My daughter and best friend is in class. Please show them some love. You know that we are the aliens. When we want to show off for you, we show off completely. You guys almost blow the website for my program, for my article, and the administrator had to write me to ask what was going on. Virgin eating. Which of the following is a symptom of bulimia nervosa? Yes, virgin eating, you are correct, Diane. Kelly says electrolyte imbalance. Kelly, you're correct. Loss of weight and fatigue. Yes, you are correct. Now, when it comes to loss of weight and fatigue, for somebody that is suffering from bulimia, since they eat a lot, they might not necessarily vomit everything. They will still have situations in which part of their food remains, but they are going to keep eating, and that is very strenuous. They are going to keep vomiting or taking laxative, and that is very strenuous. So they will go into electrolyte imbalance, they will lose weight and fatigue. My friend is saying that wonderful, my sister. Scatter me head. I know, right? You not be used to with our medical terms then, but don't worry, we are with you. Okay, you mostly post things on your Facebook page too. Okay. What is your Facebook page handle? I think it's been a while. I've not seen you post anything on your page, Azinui. Fear of gaining weight. Yes, an individual that is suffering from bulimia has the first problem is fear of gaining weight. Because they are afraid of gaining weight and their appetite cannot stop them from eating, they keep eating and then taking laxative. Or they eat and then vomit. So we'll read the answers. Question number 12. We have 1. Olimboti eating, which is correct. 2. Intense purging behaviors, that is eating and vomiting, which is correct. We have C. Electrolyte imbalance, and D. All of the above. The answer is D. All of the above. Fahim, love from Bangladesh. All right, we have someone from Bangladesh. We are saying welcome to my live video. Please take some few seconds, sit on the first bench, and enjoy yourself. Here you're in a science class, so I know sometimes our words are big and frightful. If you're not science inclined, just take some time and enjoy. The class is going to be interesting, and even onlookers can learn a lot, because here is about health, and health is for everyone. All right, let's go to question number 14. Which of the following is the treatment of eating disorder? Please list some of the treatment for eating disorders. We have, I bear some same name on Facebook. I have slowed down because I researching stuff from other countries, you know. I have been posting things only about UK. All right, okay, baby. All right, please. My daughter is indicating that she has reduced the way she works on YouTube. However, she is mostly on Facebook. Please check her name and show her some love. Finger up her Facebook account like there is no tomorrow. Aisha be mommy, keep searching, keep searching. I have so many students in class now, and they probably wants to work in the UK when they finish school. So be connected. She is all about study and work in UK and other countries. So it may be you might be one of the lucky ones to come and change the story of your life and the life of that of your family. Try to keep connected. She keeps uploading the job opportunities that are available and the steps in which you can become a licensed nurse in the UK. All right, we are having Audrey says nutritional plan, correct. Victory says dietary modification, correct. Victory equally says dietary therapy and counseling, correct. Victory psychotherapy, correct. So we're having nutritional therapy, counseling, dietary modification. We have nutritional plan, which is the same like dietary modification, and psychotherapy. Because we need to understand that the first step that somebody that is suffering from an eating disorder, it starts from the brain. So you cannot just come in and try to change the individual physically. Giving them a meal plan, giving them a dietary modification without taking them through the psychological aspect of it, counseling, it will be a complete waste of time. So we first off start with counseling. After the counseling, we can now go in giving a nutritional plan, dietary modification, and seeing how they can continue in living the right way. Kelly says fluid resuscitation in case of dehydration. Correct. We need to treat it with the use of medications, because even though they might need nutritional balance, we equally need to see the aspect that some organs might already be affected. We have dehydration, we have the liver that might be suffering, we have the kidney that might be suffering. We have all these systems that are in place. The woman's digestive tract might already be having a problem. So you need to see into it that you treat with the use of medications while waiting for the nutritional therapy to set in place. Is that understood? Is there anyone that has a question about this? All right. We have the answers being recurrent episodes of purging. Okay, no. Treatment says psychotherapy, sport, dietary, dieting, and D says all of the above. Now, sport might not be the solution to the problem. Dieting might get the situation worsened because this individual is suffering from an eating disorder because they are trying to get to go dieting. And the answer will be psychotherapy. So psychotherapy in this case is correct. Now you have listed other options, which is good because we are going to realize that we will be needing all that information when it comes to case study. Question number 15. Which of the following is a type of foodborne disease? Which of the following is a type of foodborne disease? Please now list some of the foodborne diseases that you know. List some of the foodborne diseases that you know. Please, if you're coming to my live for the first time, you can just greet so that I see your name and I send you a special greetings. And if you are a returning subscriber, please, I want to say welcome and thank you for coming by. If you have not subscribed to my channel yet, please take some seconds to subscribe so that you might be able to witness this class on another day. We are going to try to normalize coming on live videos and to see that we educate the people, we educate the community on the best possible ways to live a healthy and a happy life. Because they say health is worth. Without you having a good health, even with the most riches, it is complete waste of time. So let's make sure that we can have health and we have wealth at the same time. What is it? It is all about enjoying and being happy. Please, students, answer the question. Which of the following is a type of foodborne disease? And I want you to list some of the foodborne diseases that you know. Remember, there are a lot of people watching this live. You do not want to be the one not answering your questions because they already know they are students in class. Victory, I'm waiting for an answer. Or drill. Tell Josh he was not in class yesterday, and then today he got in class, made 30 seconds, and he left. Chevelle, please answer the question. Tikum, Kelly, answer the question. Which list some of the foodborne diseases that you know? Please, madam, repeat the question. All right, Audrey. The question says, which of the following is a type of foodborne disease? So I ask that you should list some of the foodborne diseases that you know. List some of the foodborne diseases that you know. Please, viewers all over the world, if you're coming to my live video today for the first time, I want to say welcome. Please take a few seconds of your time to subscribe and like the channel so that you might be able to get notification when you come. Thank you very much, daughter of mine. E. coli is one of them. Please, this is a product of Shishong, and we don't joke, we don't carry last. Anywhere we go, we present ourselves. Salmonella, of course. Correct. Even hepatitis A. Yes, because it is Salmonella. correct? Crazy boy. Crazy boy. I'm happy that you're learning something. I'm from Bangladesh. Welcome, crazy boy. Please greet the people from Bangladesh. Are you in the afternoon, in the evening, or in the morning? I'm greeting you with respect to the time you have there. Now we are having evening in Cameroon. Yes, I know Bangladesh. I work with people from Bangladesh when I was in Dubai. Tikum Odrise E. coli, correct? All right, let me read some of the answers. We are having A to be peritonitis, B scabies, C listeria, and D all of the above. Which answer is correct? Victory say E. coli and Salmonella. Yes, you are correct. Love from Cameroon, crazy boy. Thank you for joining the live. Please do not forget to leave us a subscription and a like. I would very much appreciate to see you in my next video, which might be tomorrow in the evening. Deborah says D, all of the above. Deborah, is peritonitis a foodborne disease? Please, daughter, come and help my students, please. Deborah, is peritonitis a foodborne disease? I'm from Cameroon, crazy boy. This is Africa. We are in Cameroon. Diane, E. coli infection and norovirus infection. Diane, you're correct. I am talking with Deborah. Deborah, come and give me the definition of peritonitis. I know. All right. Okay. Thank you so very much, crazy boy. Deborah says, sorry, madam, did not get the answer well. All right. I will take it from... All right, crazy boy. Bye-bye. Tomorrow I might have another live, and I will appreciate if you're there. I really do appreciate for these few seconds you have been here. Deborah, listen to my answers. Deborah, listen to my answers. I said A, peritonitis, B, scabies, C, listerial, and D, all of the above. Good night, dear. Deborah, I'm with you. What is peritonitis? And some other person should give me Victory. Where are you? Victory, what is scabies? Good night, crazy boy. Good night. Sound sleep. Victory, what is scabies? Deborah, come and define peritonitis. Quick fun. Today is my birthday, but I am a little sad because life is too fast. Quick fun. How can you be sad because life is fast? Don't be sad, dear. Please, class, quick fun is having his birthday today. Please just wish him happy birthday. Don't be sad. We are here for you. We are cheering up. Keep fighting, okay? Don't be sad. The world is full of ups and downs. And if you have the opportunity to see another day, you should really do appreciate. You are worth it. You are everything that the world needs. The world will be lacking something without you. So do not feel like the world do not deserve you. You are very much welcome. And have a wonderful birthday. Please don't be sad. Put some smiles on your face. Venra, I do not know how I inject intramuscular. I scared. All right, Viram, he's saying that he does not know how to inject intramuscular injections because he is scared. Are you a nursing student? Which level? So that I talk to you with regards to your level. Deborah says peritonitis is the inflammation of the perineum. Correct. Peritonitis is the inflammation of the perineum. So it is not a foodborne disease. Audrey says, Madam, we also have listeriosis that causes gastrointestinal issues. Correct. That is the answer. The answer is C. Yes, Audrey, you are correct. It causes gastroenteritis or gastrointestinal problems. Victory, I said you should define scabies because I have scabies here. The best way to look and to identify any answer is to make sure that you are able to differentiate the other questions, the other answers. And you can only differentiate the other answers if you can identify and define each and every one of them. Because do not forget, nursing is a complex system, and there are a lot of disease conditions that we have to grasp and have hold of. So each time you are faced with a question, eliminate by defining them correctly. Scabies is a contagious skin infection. Correct. In Cameroon, what they call kamnogo, that is scabies, or what they call crashing, that is scabies, is a contagious skin infection that is caused by the bacteria scabiei something. It is a contagious skin infection. Thank you very much, Vikram. I don't know if I'm pronouncing your name correctly. If I'm not, please forgive me, my dear. Which class are you, so that I can know how to address your situations directly? Because if you are a level 100 student and you're afraid of picking IM medications, I will tell you that don't worry. With time, you are going to acquaint yourself with the injection administration. If you are level 200, I should be telling you, you need to sit up. All right? Because level 200, your parents are already calling you a doctor in the house. You should accept the name by taking your full position. There is nothing wrong in picking. The only thing is you identify the muscle you are trying to pick. If it's on the thigh, if it's on the gluteal muscles, you should be picking the correct muscle. And then you're picking, either you are taking 45 degrees or 90 degrees. But if you are talking about IM, it should be 90 degrees. Straight into the muscles, you hold, you retract to make sure that you are not in any blood vessel. And if there is no backflow of blood, you send in your medication to completion, and then you can remove your syringe while applying light pressure on the position. All right, I would like you to join our classes most often so that I can be able to direct you in the right way as you so need. I know that you have magnificent professors, but you never can tell. You just learn something small that can change your life. Thank you very much, Audrey, for putting a happy birthday to Crazy Skin up there, who is sad because he is growing faster or places are running fast. He does not want to get old. Maybe he's 30, because people, when they get 30, they don't want the days to shake. All right, I'm happy that brings you a clue. It is very important that you gain courage, because if you are afraid of picking IM, you might equally be afraid of blood and suturing. But those are procedures that we need to handle them correctly. Circumcision, you equally have problems with circumcisions if you cannot pick an IM medication. Remember, we still have IV to go for. We still have subcutaneous, and you should be comfortable in going through all those processes. Yes, Zoha, I am a nurse. I wish you all the best. My fellow colleagues will surely join in the live again tomorrow. God bless you, Mom, for doing this. I am happy you are doing this for others, same as you did for me. Love you all. Mwah, 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 mwah. Sweetie, I know that you have a very, very tough day, and I pray that you should have a sweet and a calm night. Greet your husband for me and boy. Extend my love and hugs. Have a calm, 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 beautiful evening. Eat correctly and rest correctly. And extend my love to your family. Oh, thank you. I'll be here to continue where I end. I just want the healthcare professions to make a difference, because it is only by us coming here and making a real difference can there be truly a difference in the health system. Because we talk about doctors, we talk about the administrator, everything boils down on the nurses. We are the ones who take the blame if anything goes wrong. We are the ones to take the bullet. They blame us if patients are not well. They blame us if doctors make errors. So we need to be sure that we have the right information to go out there and be the best nurses that we can ever be. Victory, are you in class? Diane. All right, we'll go to question number 16. Which of the following is a symptom? Okay, no, we've answered that. Okay. Which of the following is a symptom of foodborne disease? We have 1, convulsion, 2, diarrhea, C, headaches, and D, all of the above. Question number 16. Which of the following is a symptom of a foodborne disease? Which blood vessel is the gluteus, ma'am? The gluteus, they are talking about the buttocks. That is not a blood vessel, that is a muscle. The muscles that aligns your buttocks is called the gluteal muscles. So that is where, and that is the best area where you can pick an IM injection. Mom, it's past my bedtime, but I do not want to sleep. What to do? If it's past your bedtime and you can't sleep, you can just sit on live here with me, all right? And when you feel like sleeping, I will tell you good night. That way you will sleep well. There's no need forcing to sleep. But if it is been a current situation where you can't sleep in the night, then I want you to check on what you do. Because if you do not work hard enough, you might have problems that the whole day you have been lying on bed and there is no way you can sleep. You should make sure about that. If not, you are doing just well. Just sit with me online. Learning is not a problem. Please, 1 minute so that I can attend to something. All right. Viriam says diarrhea. Diarrhea, we say answer number. Question number 16 is that so. Which of the following is the symptoms of foodborne disease? We have question number 16. You are correct. The answer is diarrhea. Deborah, you are correct. Answer is B, which is diarrhea. I'm so happy that you're joining, and I'm so happy that this is making a difference and is helping you to understand how the system moves. Yes, the answer is correct. It's diarrhea. Diarrhea is the significant and one of the disease conditions when we are talking about foodborne diseases. We are either talking about vomiting or we are talking about diarrhea or abdominal pains. So there will be severe abdominal pains, there will be diarrhea, there will be vomiting. So if you do not see diarrhea, you do not see, if you do not see vomiting, you do not see abdominal pain, then we'll be looking at diarrhea. And in this situation, the medications that will go for this individual, will be talking about Cipro, Metro, Cetaphil. We need a strong antibiotics so that it takes care of this. But these antibiotics, no matter what you give, never lack Metro, because Metro is an anaerobic antibiotics that take care of bacteria that are anaerobic. The bacteria that are present inside the digestive tract do not use oxygen for respiration. They use carbon dioxide, and that is what the magic Metro goes to do in your stomach. Or they call it Flagy. It is either Flagy or Metro. I'm sure in and out of Cameroon they are the same names. All right, let's go to question number 17. Which of the following is a way to prevent foodborne illnesses? So how can we prevent foodborne disease? Tikum, you are correct. The answer is B. Ngo Chavel, you are correct. The answer is B. That is diarrhea. Which of the following is a way to prevent foodborne diseases? So how can we prevent foodborne diseases? Cipro, Metro. Okay, ranitidine is mostly used for H. pylori, the bacteria H. pylori. All right, but for Metro, Cipro, we'll use it generally for all types of foodborne diseases. So ranitidine is mostly used for the H. pylori bacteria that affects the that causes gastritis. Is that understood, Veram? Hello. Deborah, proper hygiene, correct. One of the first thing about foodborne diseases, we either eat it from food or we drink it in water. So the first thing is proper hygiene. Whether it is water hygiene, whether it's food hygiene, or is the body, general body hygiene, the individual should be capable of keeping good hygiene. African girl, yes, I'm African. Proper hygiene when handling food, correct. So we read the following answers. A says cooking food to a safe internal temperature. The food should be cooked at a safe temperature. People that normally eat raw food or just take meat and put on the fire for 3 seconds, they remove. It doesn't work that way. You are going to be liable to suffer from a foodborne disease. Side effects of Metro is H. pylori or not? No. Listen, Veram. When an individual has foodborne disease, the individual takes Metro, that is metronidazole, either in tablet or in as drip, that is injectable through IV. Now, if an individual suffers from H. pylori is a bacterial infection that affects the stomach lining. All right. Thank you that you understood. Brian says cooking food thoroughly. Yes. Cooking food thoroughly is one of the aspects of preventing a foodborne disease. We have to washing hands before handling food. That is number one thing, because they always say that most of the things that the healthcare professionals do to transmit disease conditions in the hospital is because of lack of proper hand hygiene. So you should make sure that you have proper hygiene. Number 4, we'll be looking at C, we'll be looking at storing food at proper temperatures. So if you've cooked food and you keep that food for say 5 to, or let's just say 2 to 3 days, and you don't warm that food correctly, and the food is not stored in a freezer, that food is not good for consumption. If you eat the food at that period of time, you are liable to suffer from a foodborne disease. You are welcome, Vikram. Welcome, my dear. D says all of the above. So answer number 17. What is the answer for question 17? What is the answer for question 17? All right, while you bring your answers, let's just go ahead with question number 18. Which of the following is a type of food allergy? We have A, peanut allergy, B, quinine allergy, C, dust allergy, and D, all of the above. Yes, Kelly, the answer for the question number 17 is D. You are correct. Victory, the answer is D. Veram, D, correct. Tikum Audrey, poor hygiene, get food well cooked. You are correct. Tikum. Ngo Chavel, D. Okay, let's go to question number 18. They say which of the following is a type of food allergy? Food allergy. A says peanut allergy. B says quinine allergy. C says dust allergy. And D says all of the above. Listen to the question. The question asks, which of the following is a food allergy? You cannot say all of the above because quinine is a medication allergy. It is not a food allergy. Thank you, Victory. Thank you so very much. The answer is A, not D. There is quinine. Quinine is a medication allergy. While C is an airborne allergy. It is not a food allergy. The only food allergy is peanut. Peanut, that simply means granite. What we know as granite is what they call peanut. Diane, your answer is correct. Okay, no problem, Cheryl says sorry. A is correct, all right. Brian, A is correct. Oh, yes, Veram. The answer is A because B says quinine. Quinine is a medication allergy, not a food allergy. While C says dust allergy. Dust is an airborne. It's not a food allergy, all right? So let's go to question number 18. Which of the following is a symptom of food allergy? A says hives. B says swelling. D says difficulties in breathing. Question number 19. What is the answer? Quinine is a hydroxychloroquine. Yes, quinine is hydroxychloroquine, which is a medication. It is used in the treatment of malaria. Quinine is safe in the third trimester for pregnant women, but not safe for the first trimester as it can stimulate contractions and hence abortion. Question number 19. Which of the following is a symptom of foodborne disease? We have A, hives, B, swelling, C, difficulties in breathing, D, all of the above. What is the answer, please? D. Bryant, you're correct. The answer is D. An individual that is suffering from allergies will have all of that as symptoms. Correct, Audrey. Correct, Victory. The answer is D. Question number 20. Which of the following is a treatment for food allergy? Diane is correct. Answer D. Which of the following is a treatment for food allergy? A, avoidance of the allergen. B, epinephrine, auto-injection. C, antihistamines. And D, all of the above. Question number 20. What is the answer? Which of the following is a treatment for a food allergy? A says avoidance of the allergen. That is avoiding what is causing you to have the allergy. B says the administration of epinephrine, auto injection, and C says antihistamines. D says all of the above. Audrey says A. Shava says A. Takum says A. Viram says C. All right. The answer, all of you are wrong. The answer is D. Now listen to the explanation. The question says which of the following is a treatment for the allergy? A says avoidance of the allergy. That is number one way to treat a food allergy. The best way to treat a food allergy is to avoid the allergy. All right? You avoid the allergy, you avoid the allergen, which is the food type, and then you stay safe. Number two, the best way to treat it is to administer epinephrine auto-injection. Epinephrine is going to suppress the immune system and help you control the allergy by not getting a reaction from the food type. And then antihistamines. Antihistamines will equally help you to suppress the immune system. What is an example of an antihistamines? Give me an example of an antihistamines. Epinephrine injection is a steroid or not? Yes, epinephrine injection is a steroid. Or not? Is it a steroid? It's a steroid. You are correct, Vic. Faithful Nadine. Faithful Nadine. Are we together? Yes. Please give me examples of antihistamines. Hey, Mohab. Welcome to my life. Please take few minutes. Just correct, Victory. Diazepam. Diazepam is the most common type of antihistamines that is used here in Cameroon. We mostly use diazepam for almost all allergies or chlorpheramide. Thank you very much, Victory. Thank you. Is that understood? Kelly, is that understood? Diazepam. All right, now diazepam, yes, but the function for diazepam is to weaken the muscles and stop the individual from reacting to the allergy aggressively. When you stop the muscles by causing that extreme relaxation, and then you go ahead to control. Yes, Veram, you're correct. Are we together? Can we go to the next? Any question? Can we go ahead? All right. Which of the following is a type of food intolerance? Which of the following is a type of food intolerance? We have A. Lactose intolerance, B. Gluten intolerance, C. Formal intolerance, and D. All of the above. Which of the following is a food intolerance? For those that are just watching us and not commenting, you are in a nutritional pathology class. That is why everything we talk about is with relation to food and pathology. This is a nutritional pathology class. Level 200 nursing. So we are preparing for our exams. Lactose intolerance, correct? So is gluten intolerance not part of the types of food intolerance? What is the answer? We have which of the following is a type of food intolerance? A. Lactose intolerance. B. Gluten intolerance. D. Format intolerance. And D. All of the above. Correct, Victory. The answer is D. All of the above. All the other types are food intolerance. Veram, is that okay? Is that understood? So we have lactose intolerance, we have gluten intolerance, and we have format intolerance. They are all types of food intolerance. Correct, Diane. All right, let's go to the next question. Which of the following is a symptom of lactose intolerance? Which of the following is a symptom of lactose intolerance? We have A. Bloating, B. Gas, C. Diarrhea, and D. All of the above. What is the answer, please? It's okay, Veram. You listed one, not that you are completely wrong. Question number 22. Which of the following is a symptom of lactose intolerance? We have A. Bloating, B. Gas, C. Diarrhea, and D. All of the above. Veram says constipation, bloating, and gas. Correct. You are correct. We have bloating, gas, and diarrhea. Now, what is the difference between diarrhea and constipation? Ticum or drill? D. Yes, I want to have what is the difference between constipation and diarrhea? I said the best way to answer a question is to rule out the wrong answers, and then you'll be left with just the right answer. Vigram, what is the difference between constipation and diarrhea? Exactly. Constipation is someone who has been for days without going to the toilet. That is the absence of stool. Someone that has been unable to go to the toilet and have free, enjoyable shitting. Why somebody that is suffering from diarrhea is having loose and watery stool? The answer is D. We are talking about constipation, bloating. We are talking about diarrhea, bloating, and gas. Question number 23. Which of the following is a treatment for lactose intolerance? A. Lactase enzymes supplement. B. Avoiding diarrhea product. D. Drinking lactose-free milk. And D. All of the above. All right. I'm happy it's understood. Question number 13. Question number 23. Which of the following is a treatment for lactose intolerance? Lactose enzymes supplement, avoiding dietary product, drinking lactose-free milk, and D, all of the above. All right. Thank you for the research, Audrey. Diarrhea is the regularity, frequency of bowel movement with increased stool and altered consistency, while constipation is the irregularity and passing of hard stool that might be very painful. Correct, Victory. Thank you, Audrey. Was there a question for that? I see Veram giving you a thanks. He had surely asked the question. B. Miriam, you have not been in class yesterday. You were not in class today because we started the first class and then the network was disturbing. I did something and I blocked the live before I created the second one. Miriam, you're just coming to class now. I deserve an apology from you. Use of lactose-free product. Correct, Brian. The use of lactose-free product. Now, some studies will have it that there are lactose enzymes supplements that will help you not to be lactose intolerant. It will help your intolerance of lactose. It will help to build your immune system to be strong and not to react to lactose. And then we equally have avoiding dietary products, which is correct, and lactose-free meals, which is correct. So for this question, if you are going to have lactose enzyme supplements, not lactose supplements. So we're having two modifications. There is lactose supplement, which simply means that you are taking like calcium supplements. Because you lack calcium, you take calcium supplement. But in this case, you are taking lactose enzyme supplement, which indicates that it is the enzymes, the enzymes that are used to prevent you from reacting to lactose. So the answer is D. Tikum says your answer is correct. All of the above. Is that okay, Brian? Yes. Bryant, Bryant is coming from Oxford University. They understand big grammar. You took it very small and simple. Good evening, madam. I'm very sorry that I'm late. We never had live. and the whole of yesterday and today. It finally came back but this evening and I really apologize. You're welcome. Apologies accepted, Miriam. All right. If that is understood, let's go to the next question. Question number 25. Question number 24. Which of the following is a type of celiac disease? We have A, abdominal pain. Which of the following is a symptom of celiac disease? A, abdominal pain. B, diarrhea. C, weight loss. D, all of the above. You're welcome, B. You're welcome. Which of the following is a symptoms of celiac disease? We have A, abdominal pains. B, diarrhea. What is the answer, please? We are having 5 questions to finish the multiple choice. So please, let's be fast so that we can finish. Thank you very much, Tikum. Thank you, Audrey. Answer is D, correct? Ngo Shavel, answer D, correct? Miriam, answer correct. All right, let's go to the next question. Which of the following is a treatment for celiac disease? We have A, gluten-free diet. B, medications. C, surgery. D, all of. Are we present? Gluten-free diet, correct. If you were in my class, I would have given you 1 mark. Answer is A, gluten-free diet. Yes, Bryant. The answer is A, you're correct. A, you're correct. Victory. Victory, the answer is A, not D. Victory, the answer is A. We are talking about gluten-free meals. All right. Question number 28. Which of the following is a symptom for format intolerance? Okay, question number 27. Which of the following is a type of format intolerance? We have A, fructose intolerance, B, lactose intolerance, and C, sorbitol intolerance, and D, all of the above. Question number 27. Remember, we talked about formats yesterday, so this is a revision. What is the answer? What is the answer, please? The answer is D, all of the above. Can somebody help us with a full definition of format so that Vikram will understand what it means? Victory, come and represent yourself. Deborah, where is Bryant? Blandine was not in class today. Chika seems to be having network problems. She has gone and she has not come back. Josh came to this class for 1 second and he left. Bryant is back. All right, Bryant, I see you. The answer is D. The answer is all of the above. Victory. What is format intolerance? Okay. Vikram, Victory has helped you, Diane has helped you with format intolerance. It is fermented oligosaccharides, disaccharides, monogosaccharides, and polygosaccharides. And that is why the answer is fructose, lactose, and sorbitol intolerance. All of the above is correct. Is that understood? Vikram, are you with us? Thank you very much, Diane. Question number 28. Which of the following is a symptom for format intolerance? A, bloating, D, vertigo, C, constipation, and D, all of the above. Which of the following is a symptom of format intolerance? We have A, bloating, D, vertigo, C, constipation, D, all of the above. Diane, you can take your flowers. They are giving you a thank you. Please, I'm waiting for the answer. Question number 28. A, correct. Brian says D, no. Which of the following is a symptom for format intolerance? Bloating, vertigo, constipation, all of the above. Vertigo is not a symptom for format intolerance. The answer is A. Deborah, you are correct. Diane, you are correct. Brian, you are not. It's okay. It's okay. You are going to get there. Please, which class are you? Which class? Which level? Level 100, level 200, or level 300? No problem. No problem, Brian. You just go ahead. Question number 29. Which of the following is a treatment for format intolerance? We have A, taking high format food, B, avoiding triggered food, D, taking antibiotics, and C, taking antibiotics, and D, all of the above. What is the answer, please? We say, which of the following is a treatment for format intolerance? A, taking high format food. B, avoiding triggered food. C, taking antibiotics. And D, all of the above. Please, what is the answer? Question number 29. B, correct. The answer is avoiding triggered food. Shelly, correct. Diane, correct. All right, question number 30. Deborah, you're correct. Shavel, you're correct. Which of the following is a rule of a registered dietitian? So let's just list the rules of a registered dietitian. B, Bryant, you are correct, my dear. Which of the following is the rule of a registered dietitian? List the rules of a dietitian. Please list the rules of a registered dietitian. If someday you decide to be a dietitian or a nutritionist, what will be your rules? Nutritional plan, correct. The individual is in charge of producing a nutritional plan for the patient by Kelly. Shape the dietary choices of a of healthy and sick people, correct? The individual is supposed to make a diet plan or choices for healthy and sick people. Not only the sick individuals are supposed to have a dietary plan, even you who is healthy supposed to know or have a dietary plan that is safe and good for you. As equally, they equally go for uh, community work, and when they go for community experiences, they meet a diverse population. They might be treating population suffering from tuberculosis, population suffering from HIV, kwashiorkor, whatever they meet, they are supposed to treat those individuals. Counseling, correct. Making meal planning, yes. Give proper food, diet, and nutrition, correct. Education and counseling, correct. Nutritional plans and counseling. Yes. Thank you so very much. I really appreciate the fact that we all made it possible to be here today. Education and follow-up, correct. I think that was the one answer that we almost forget yesterday, and it still happened today. So is everyone that is in class now, was everyone that is in class now in class yesterday? Because I think we did not go through the multiple choice. We went through the structurals and the essay questions. So except I have somebody that was not in class yesterday. Kelly was in class yesterday. Victory was in class yesterday. Deborah was in class yesterday. Diane was in class yesterday. So who was not in class yesterday? Who has a question? Who has a worry? Who has that's a question because that is supposed to be our class gradually going to an end. Shovel said I wasn't. You wasn't where? Shovel, I saw your name yesterday. Tuku, madam, I'm not in class. I was not in class yesterday. I came late. Brian says I came late. So which aspect, where did you not get the case study? So you guys want us to continue this class? If you want us to continue the class, you indicate, please. Yes, Madam Tiku Modri, yes. Odrin was not in class yesterday. George says I wasn't. So Josh, you are in class. You are in class and you're not talking and you have your phone with you. All right, let's continue. We already saw part of the questions. I think Gustav is indicating that it's not light, so you cannot be in class today. We saw part of the questions of the structural in class, and you guys complain of the difficulties that you are going to face if I had to take it that way. So there was a little bit of modification as in respect to trying to see that you guys keep to mind, and anyway, it was to help you to prepare for all the other systems. So we'll continue with question number 4, which says, which of the following, okay, what is the most common type of malnutrition in the world or worldwide? Please, here we'll answer it. Yes, ma'am. Sorry. Thank you for all. God bless you. Thank you too, Brian. All right, George. I'm here. I want someday that I will feel free and get sick. Don't worry that the nurses I sent out are not capable of taking. So this is my own period of sacrifice. When I come to the hospital, you'll be working. You are going to have a very complicated patient. And then I'll tell you that I'm feeling free to do the nasty things because you did me nasty when you were in school too. All right, so we are going to question number 4. The answers are straight and forward. So please, I would like you to respond so that we get, if you don't, because we still have case study to go through. Question number 4. What is the most common type of malnutrition worldwide? What is the most common type of worldwide? Protein malnutrition. So I always advise you don't say protein malnutrition, because when you talk about protein malnutrition, you are talking solely kwashako. But when you talk about protein energy malnutrition, thank you, Diane. When you talk about protein energy malnutrition, you'll be talking about marasmus and kwashako. And that is where we are going to, because the most common type of malnutrition that is worldwide is protein energy malnutrition, which is kwashiorkor and marasmus. All right, Brian. Okay, so let's go to the next question. What is the deficiency disease caused by the lack of vitamin C? What is the deficiency disease caused by the lack of vitamin C? You're welcome, Diane. What is the deficiency disease caused by lack of vitamin C? Undernutrition, especially protein malnutrition. Yes, protein energy malnutrition. Yes, that is the answer, my dear. Miriam, it is a protein energy malnutrition, which is kwashiorkor and marasmus. What is the deficiency that arises from the lack of vitamin C? Are you guys getting me? Should I stop the live and start it all over? Should I stop the live and start it again? Curvy, correct, Brian. Should I stop this live and start it again? Are you guys having difficulties getting me or getting connected? Alright, Brian says it's okay on his side. Because I'm not seeing others responding. That is why I believe. Alright, Kelly's is equally being connected. Alright, Kelly. So Bryant is correct. The answer is curvy. Curvy is the condition that is caused by lack of vitamin C. Question number 6. What is the name of the condition characterized by an enlarged liver due to fat accumulation? What is the condition caused by an enlarged liver due to fat accumulation? Curvy is the correct answer for the previous question. Audrey, you're correct. Diane, you're correct. What is a deficiency caused by a lack of vitamin C? What is the condition characterized by an enlarged liver due to fat accumulation? That is where we are now. Fatty liver disease, correct, Kelly. The condition is known as fatty liver disease. Is that understood? Mambo. Oh. Mm-hmm. Yes. Okay. 1 minute, please. Oh, but if you not, if you want to finish on it, no, sir, no, for that. Yeah. I said this student will not finish on it, then it will not show. It is never broken. I'll keep on open. Fatty liver disease. Fatty liver disease. That is correct. The condition caused by accumulation of fats around the liver is known as fatty liver disease. What is the most common cause of food poisoning? No, madam, is okay on my side. Okay, Audrey says the network is okay on her side. What is the most common cause of food poisoning? Bacterial infection. Correct, Brian. The most common cause of food poisoning is bacterial infection. Bacterial infection, George, you're correct. The most common type of food poisoning is bacterial infection. Is that understood? Miriam, bacterial infection, Audrey, all right. You're all together with me. When I see the comments coming, it means everybody's getting me correctly. Okay. What is the name of the condition characterized by inflammation of the stomach lining? What is the condition characterized by the inflammation of the stomach lining? What is the condition characterized by the inflammation of the stomach lining? Gastritis, correct. Brian? George, correct. Audrey, Miriam, are you guys there? Diane, the next question. What is the most common type of cancer of the digestive system? Just put that for some side, please. Now cover that. Put that blue cover on top. Good night, Mamba. Colorectal cancer, correct? The answer is colorectal cancer. That is the most common type of colon or of digestive cancer of the digestive system. Colorectal cancer. Kelly is correct. George, the answer is correct. Colorectal cancer. Miriam is correct. Colorectal cancer. Brian, the answer is correct. All right, let's go to the next one. I've not seen Tikum. Tikum is not online. Tikum, I hope you're understanding if you are still around. What is the name of the condition characterized by difficulties in swallowing? When somebody has difficulties in swallowing, what do they call that? What is a condition that is characterized by difficulties in swallowing? Dysphagia. Correct, Brian. Josh, dysphagia. You're correct. Kelly, thanks so much for the sacrifice, madam. My battery is low. Alright, Kelly. Have a wonderful night. I wish you all the best as you start from tomorrow on Monday. So you guys should go and succeed. You should go up there and represent yourselves and your family. Miriam, dysphagia. Yes, dysphagia. Miriam, you're correct. Alright, let's go to the next question. What is the most common cause of pancreatitis? Failure is not an option. Well, you have the best motto ever. Failure is not an option. Nobody is permitted. You no permission for anyone to fail. So if you are thinking of failing, you probably just have to change your name. Okay, okay. What is the most common cause of pancreatitis? What is the most common cause of pancreatitis? Are you guys still there? Are you getting me? Gallstones. Kelly, you're correct. Gallstones. Diane, you're correct. Miriam, gallstones, you're correct. Brian, gallstones, autoimmunity. Gallstones, you're correct, George. All right. What is the name of the condition characterized by inflammation of the small intestines? What is the name of the condition characterized by the inflammation of the small intestines? What is the condition characterized by the inflammations of the lining of the small intestine? All right, Audrey, I can see you now. Gallstones. All right, Audrey is still answering the previous question. Diane says enteritis, correct. Brian, enteritis, correct. George, enteritis, correct. Yes, the answer is enteritis. That is what, when somebody is suffering from diarrhea, vomiting, they say the individual is being diagnosed with gastroenteritis. Enteritis, correct. What is the most common type of liver disease worldwide? The most common type of liver disease worldwide. Hepatitis, Brian, correct. George, hepatitis, you're correct. All right, we are done with the structural questions. Now listen and listen carefully. Is there anyone that has a question to ask about the questions that just were asked? If you have any question, you indicate. Are you guys still with me? Is everyone getting me? Should we retire for the day? Brian says, I'm getting you. Okay, Brian. So can we go ahead? All right, Miriam is online too. Okay, so I'll read. A 20-year-old lady came to the hospital with the following signs and symptoms. A BP of 166 on 34, fasting blood sugar of 55 milligrams grams per deciliter, a distorted body image. During systemic questioning, she said she has intense fear of gaining weight. Question number 1. What is the name of the eating disorder? What is the name of the eating disorder? I see you, Audrey. I know your network is not the best, so it comes after. I'll read the question again so that if somebody did not get that, the person can hear it now. A 20-year-old lady came to the hospital with the following signs and symptoms. BP of 66 on 34 milligrams per deciliter, fasting blood sugar of 55 grams per liter, a distorted body image, and during systemic questioning, she said she has intense fear of gaining weight. Question number 1. What is she suffering from? Question number 1. What is she suffering from? Anorexia nervosa. Thank you, George. Any other answer? Anorexia nervosa, Bryant. Thank you, Bryant. Audrey say anorexia nervosa. Miriam, are you there? Influenza. Rayan. The answer is not influenza. You should listen to the question one more time. The individual is having a low BP, a sugar level of 55, and has a distorted body image, and during questioning, the patient verbalizes that she has intense fear of gaining weight. Those are signs and symptoms of an individual that is suffering from anorexia nervosa, which is an eating disorder that is characterized with intense fear of gaining weight, and the individual goes on prolonged fasting. Welcome, Ryan. All right, I'm glad you now understand. Okay. All right, question number 2. What are some of the physical and the psychological symptoms of answer number 1? First of all, we are talking about physical and psychological. Ryan says it's asthma. It's not asthma. Asthma as a differential diagnosis, we'll be talking about wheezing signs and difficulties in breathing. That is a respiratory disorder. But here we are talking about eating disorders. So you are in a nutritional pathology class, Ryan. So we are not talking about respiratory problems. We are talking about mostly digestive and systematic problems that are associated to nutrition. I hope you understand. So they are asking us to give signs and symptoms of A. Weight loss, fatigue, low self-esteem, pale. Yes, pale is still associated to weight loss. Yes, my dear. Take home. Where are the others? I'm waiting for your answers. We are almost coming to an end. What are some of the psychological and physical symptoms of anorexia nervosa? If you're joining my live for the first time, I want to say welcome. Here is okay. It only happens that I don't understand German language. Please, if you can write in English, I will appreciate so that I can see and I can welcome you to the live. Madam, I'm getting you. You guys have given me the physical symptoms. Can you give me the psychological symptoms? Oh, you are Arabic. Salam alaikum. Kefalek. All right. Shukran. Shukran, Habibi. Yes, Josh, I've seen the physical symptoms. I want the psychological symptoms. Yes, I learned Arabic. Shweye shweye parle Arabic. Shweye shweye kalam. Discrimination. Discrimination? Why do you say discrimination? Discrimination on what? Remember that nervosa bulima is a self-destructive disease. They really don't destroy others, they just destroy themselves. The next question. How is bulimia nervosa different from anorexia nervosa and unlimited eating disorder? I still don't understand you, Brian. Other discriminating things like shukran, shukran, habibi. The question comes in, how is bulimia nervosa different from anorexia nervosa? Josh, Audrey, Miriam, Brian, are you guys online? All right, Brian. What is the difference between bulimia from nervosa? It's going on. Please let midnight not meet us. Let's finish quick so that we can rest. You guys need to rest so that tomorrow you get up still early enough to revise before going to church, and then come back tomorrow to sit and read your books. Your buttocks must be able to sit on one position for 3, 4 hours, 5 hours without getting up to go anywhere. Prepare for your exams as though there is no tomorrow. You must be able to hold yourself. You must be able to eat and then rest correctly. Then when you get up, be ready to study. Except you're doing a revision with somebody or with someone, there is no reason why you should be distracted with your phone when you start reading. Is that understood? Yes, comparison, Brian. Comparison, the differences. Just tell me the comparison. How is bulimia different from nervosa? Are we still online? Are we online? George. Anorexia nervosa is refusing to eat while Bolima is eating in large amount of food and removing it via vomiting or laxative. Correct. Brian, you're correct. Brian, what is Olimboti? What is Olimboti eating disorder? How is it different from those two? Unlimbote. Unlimbote. Are we there? Is the question understood? I'm waiting for you guys, please. Miriam says, agnoresia nervosa can make the person very thin, while bulimia can lead to dehydration. That is the same thing. They all are going to be thin at the end of the day. When the person is thin, the person is going to be dehydrated, right? So that is not a difference. Olimbotsu is eating without stopping. Are we okay? Good evening, big sis. Big sister is in the house, class. Good evening. Much love. I'm so happy you passed by to greet me. I asked you the question. That is why I asked you the question. I'm fine, big sis, and you? How are you doing too? How was the day of today? Thank you, Brian, for extending greetings. That my other sister is writing from the US. So please, class, show some love. We are having 2 questions to go. What are some of the resources available for people with eating disorders? So when we are talking about resources for somebody that is in Cameroon, what are some of the resources that are available for somebody that is suffering from an eating disorder? What are some of the resources available for people that are in Cameroon who are suffering from an eating disorder? Is there anyone in class? What are some of the resources available for somebody that is suffering from an eating disorder, especially here in Cameroon? Because I know out of the country there are a lot of resources. Thank you so very much. Thank you so very much, Big Sis. So I really appreciate that you passed by. I'm so, so grateful. Thank you so very much. Yes, ma'am, please question again. I asked, what are some of the resources that are available here in Cameroon for somebody that is suffering from an eating disorder, from somebody that is suffering from bulimia or anorexia or limboti or orthorexia nervosa? So if you are joining my live for the first time, welcome, welcome to you, elder sister. And here we are in uh, a nutritional pathology class. So we are preparing for last minutes for our exams next week. That is why you are going to be hearing a lot of big terms in medicine. Don't be afraid, the class is too interesting even if you don't understand, because we're always going to break it down. It's still going to help you understand certain things that has to do with health, has to do with food, and has to do with in association with other organs. Please do well to just click the like button and subscribe to the channel. We will be coming live this time around at least 4 times a week. 4 times a week to talk on different disease conditions. And tomorrow in the morning, I will prepare for the one for tomorrow in the evening and I will send it forward. Fluid, fluid resuscitation. Nope. I asked, what are the resources available in Cameroon for somebody that is suffering from any of these disease conditions? What I'm trying to ask is, you can tell me as an answer. Question number one, uh, they are health insurance. That Cameroon is providing health insurance for the people that are suffering from nutritional pathology, obesity, nervosa, anorexia, or bulimia. They are providing them with health insurance. That is a resource that has been produced by the state. That is if all is available. We don't have it that here. If you are suffering from any condition, you got to pay that by yourself. Now, number two, you can say there are availabilities of dietitians or nutritionists that are able to assist patients who are suffering from. Exactly. So now you understand what I'm going by. They are healthcare, they are nurses educators. Like myself, I am a nurse educator. I'm not bothered being called a professor. It does not concern me that way. I am much more happy being a nurse and a nurse educator, because you approach life at the very basic form to meet the needs of those that actually are looking for that. When we go to the higher forms, we are going to be looking at the needs of those that can pay for it. But if you are below and you are looking, you are just a nurse educator that is trying to meet the health of everyone, you are looking at the need of everybody in the community, no matter who they are. Support group, exactly, Josh. Dietitian. So that those are the resources I'm asking. Support groups, dietitians, physiotherapists that are available, counseling halls, health insurance that is available for individuals that are suffering from a nutritional disorder. Thank you very much, Josh. How can it be prevented? We are having one more question. How can it be prevented? How can we prevent bulimia or nervosa or any of the eating disorder? How can it be prevented? Therapy and counseling, correct? Yes, I guess Tikum had slept already. She's a baby in the Lord. Yes, Josh, I'm listening. How can it be prevented? Okay, let me, Miriam, you talked about therapy and counseling. I might not really accept therapy and counseling because it is a rehabilitation system. It is not a promotive system. When they're asking for prevention, we are asking you to give us the promotive health, not the rehabilitative health. Because somebody got to, no, I'm refusing that. That is why I'm refusing. Support group is a rehabilitative health. Tikum, I'm still refusing that. How can you prevent from having it? Because it is after you have gotten any of these disorders that you'll be in need of therapy, that you'll be in need for counseling, that you'll be in need for support group. That is a rehabilitative state of an individual. But prevention, it is a promotive state. So give me what it takes to promote, not what it takes to rehabilitate. No, Tikum. Tikum or drill? No, the answer is still not correct. Now talk about health education. Health education, that is promotion. That is promotion of health, not rehabilitation of health. All what you're doing is a state of rehabilitation. When the individual has fallen into depression, has fallen into this disease condition, then they start counseling them. So when we are talking here about health promotion. We are talking about building self-esteem, correct, Brian? We are talking about giving counseling to the individual, telling them that they are good enough, telling them that even if you feel like you're ugly, you're not ugly, you're beautiful. You don't have to listen to what others have to say. Uplifting individuals, looking at individual at a healthy point of view, and not bullying people because they are fat, because they are thin. Even if somebody wants to be a model, the person can be a slim model or the person can be a chubby model. Why does it has to be slim? If you uplift people and build their psychology to make them understand that they are beautiful the way they were born, you are going to help them to live a healthy and a beautiful life, and not drive somebody into depression simply because you want to build a certain moral standard. No, not moral standard, a certain societal standards that fits certain set of people. Because while others want you to look like a pencil, others want you to look like an elephant. So who is wanting who? You just need to love yourself the way you are, and that is what we should be focusing on. Yes, that is still under education. We educate the individuals about nutrition. We educate the individuals about hygiene. We educate the individuals about self-worth. You need to tell them that they are worthy enough, that the earth is good enough for them. You need to be kind enough. I always tell you, be kind with each other. If you cannot even take care of each other in class, if you cannot be kind with your brother or with your sister, how do you expect to be kind with a patient that you have not known? How do you expect to be kind with a patient that will come and go, and the person that is sitting right beside you, you don't talk with that person? And the person that is sitting right beside you, you cannot be nice to the person. I'm not saying that people cannot hurt you. If people hurt you over and over and you realize that you cannot take it, you need to give a healthy step away. Not necessarily having a bias or a malice with that individual, because holding grudges with somebody will still keep you in the same situation. You simply need to healthily tell yourself, I cannot live closer to somebody that keeps bringing me down. Encourage self-awareness, of course. Because if you are an individual that is lame and you know already that you have a problem with your leg, I do not see why somebody has to tell you that with your bend foot and you're angry. I had a foot bend from the get-go. That is just a reminder to me. It's no more an insult. So when the people are self-aware of who they are, they don't get angry because of the things that you say. If you tell me that I have broken teeth and you are making it look like an insult, how would that be my concern? I'm going to take that as a compliment because I know, and I don't need you to remind me about that. Education on nutrition, correct, Etikum. You need to educate the people on nutrition. You need to tell them balanced diet. You need to tell them the importance of taking a complete and a balanced diet. It was before that, because you have diabetes, they tell you don't eat this, don't eat this, don't eat that. No. Now we encourage each and everyone to eat a balanced diet, but in small and frequent quantities or quality, not necessarily eating in bulk. Somebody will go and eat food that is equivalent to 5 people in the house. No. All right, Miriam. Thank you. Okay, thank you for the clarification. Early intervention, correct. You should be able to tell the people what to expect. If you're having fever, if you're having diabetes, if you're having headache, if you're having this, if you start noticing this, you need to go to the hospital as fast as possible. I am saying so because when somebody wants to get into depression, it is only at the early stage can they know that something is wrong with them. It is only at the early stage can they say, no, I think this has been days I have not bathed. Something is wrong with me. It is only at early stage they can tell you, I've been angry, I've been hostile, I've been this, I've been that. But when they have gone deep down the depression, the depressive state process, it is difficult for them to even realize that they have a problem. It is difficult for them to even realize that something, they are not behaving normal. It will only take a loving and caring family or a loving and caring friends to identify that their friend is going through a period of depression or period of difficulties, and be able to call the individual in and take the person to the hospital in time. All right, Tikum. Okay, I get it. Yes, I have thrown more light on educate them on nutrition. Audrey said that up. All right, let's go to the last question. List some systems that are affected by these disorders. List some systems that are affected by eating disorders. Healthy eating. Yes, Miriam, you are still answering the previous question. Healthy eating. Correct. The digestive system, the immune system, the endocrine system, the the muscular system, the urinary system, the circulatory system is in fact all the systems. Tomorrow you need to list them at least. All right. Thank you so very much, Bryant. You are correct. Let's round up, oh, let's round up so that some people can go and sleep. You need rest too. Tomorrow I'm starting morning. I'll be having live in the evening, but I will not be expecting you guys to join that live because I'll be expecting that you will be studying and revising for what you will be writing on Monday and Tuesday. I guess I've done a thorough revision for you all. You will just then revise maybe the last night that you're going to write. Are we all in class? Is there any question? If you're having a question, ask now. All right, Brian. I will send it to the group. I will send it to the group. Tomorrow, I would like to talk on ectopic pregnancy and how these women can gracefully progress from an ectopic pregnancy in having a complete understanding and how deadly it can be, because we've have few cases these days and it's not looking good for my sisters out there. So I will be here tomorrow to talk on ectopic pregnancy. Is there any question? Anyone has a question, please ask now, because this is our last revision class. Endocrine system, yes, Audrey. Central nervous system, correct. Reproductive system, yes. Any question? Are we okay? George left the class already. All right. So can we call off the day? Big sis, I hope that at least the 2 seconds you entered the class, you were able to learn something. The digestive system, the urinary system, the endocrine system. All right, Josh, you're correct. Miriam, are we together? Is there anybody having a worry? If you're having a problem, you indicate. All right, Audrey. The tomorrow will be starting. I will start the live by 8 o'clock, and I'll end when the people are equally there. 8. All the live will be at 8. I'll be having the live tomorrow at 8, and I'll be sharing the next one at 8 too. I probably do not have a lot of time to record and post, so I'll be going live at once to do the video, and then the remaining one can rest. I'll be live big sis tomorrow by 8. I'll create it in the morning and I'll circulate it on the media, and then for programming to start by 8. All right, big sis, thank you so very much for joining. Too much love, too much love. Love you, sis. Thank you so very much, madam. You're welcome, Josh. So you guys should go and get some rest so that I can rest too. I'm working morning tomorrow. You know, going right to my hospital. I need to leave here by 6 o'clock. So I need to rest too. I wish you all a wonderful day. Much love, big sis. I wish you a wonderful day. I know your day is just starting. So may the remaining days of today be so gracious. May you be favored by people that you do not know them. Madam, thank you so very much. I really enjoyed the class, even though I was not there at the start. We thank God. They say the starting is not what matters, is the ending. If you can end it, then you did a great job. Thank you, madam. We are so grateful. I'm grateful to Audrey. I wish you guys the best of luck. I tell you, failure is not an option. Where's Brian? Brian, come and give us the quote again. Failure is not an option. You have to present yourself. If you don't pass with flying colors, don't say I'm your professor. I don't know you. I deny that. No student of mine is lazy. Everything that you need, you have it. So when you go to class, keep an open mind and make sure that you embrace every question and you attempt every question, no matter how complicated you look at it. Start with what you know most and then end with what you find difficult. Is that understood? I have almost been eaten alive by mosquitoes in this house. All right. Good night. Failure is not an option. Write write in such a way that the devil cannot make you fail. It's indeed writing in such a way that the devil cannot change anything. Good night, Brian. Good night. Good night, Tikum. George, good night. Miriam, good night. Amen. Amen, dear. Thank you for the prayers. I'm trying to end this live and I don't understand what is going on.